Good morning, I'm Adam Sexton. Happy New Year to all, at least as happy as it can be right now. But 2021 does offer the promise of taming the COVID-19 pandemic through vaccination. Here in New Hampshire, the state official overseeing vaccine distribution is the same man who won wide acclaim for his efforts to secure personal protective equipment and other supplies early in the pandemic. And that is former Assistant Commissioner of Safety, Perry Plummer. He's our guest this morning. Happy New Year, Perry, and thanks for joining us.
Thanks for having me.
So a lot of the national coverage lately has focused on delays in getting all the vaccine to all the states as quickly as possible. We had Admiral Brett Giroir, who's overseeing that national effort, saying recently, quote, "We need to be doing a better job." What's been the impact of those federal problems here in New Hampshire?
Yeah, certainly our goal is to make sure that the limiting factor to get people vaccinated, needles and arms, is how quickly that vaccine comes in. So, when you have a change in plans like that at the last minute, we have to go back to the drawing board, reallocate our vaccine, and make sure that it's distributed equally and equitably across the board. You can't just take so many doses out of one group. You have to kind of spread that across. So it added a little more planning, a little more logistics on our end, but certainly, it's not something we didn't expect. We expect this to be a little bit of a windy road, and to make sure that we're ready to take turns wherever we need to make sure that we can get people vaccinated in the state of New Hampshire as quickly as possible.
Obviously, all new territory as we go forward here. The latest numbers from the state, about 47,000 doses have arrived at vaccination sites, 21,000 doses administered. That's about half. I know in the draft vaccination plan, it says that if you're not seeing guaranteed regular allocations, you're going to have to start holding on to that second dose for the people who need the shot number 1 and shot number 2. Is that what's going on right now, that you're having to hold on to some?
Yeah, well, we're holding on to a little bit as we distribute to make sure that we can do that fair and equitable distribution. If something pops up that we didn't think of, we can get a needle in arm. But it's really flowing through the state extremely quickly. The second shot is being held at the federal level, and it's being shipped as a second shot. So to tell you the truth, all the stuff we're getting is going right in arms as quickly as possible, and then the second shots will be coming in as a separate distribution or a separate delivery, and then we'll be getting those out. And we'll be starting second shots this coming week.
So I know in the draft vaccination plan, it says that the goal is to be able to do 100 shots per hour at each of the 13 fixed sites, and obviously there'll be more beyond that. Is that a realistic goal? Is that something that's achievable in your eyes?
I think it is a realistic goal. We've had great success in the first few days of running it. Last Saturday, we did a soft opening, vaccinating vaccinators and people working in clinics and stuff. And then we've had 3 days of vaccinations, and it's gone extremely well, to tell you the truth. Our biggest slowdown is people have to register, they get their appointment, and then they have to go back in and look at all the disclaimers and make sure they're ready for those, and that's been the biggest hold of it. People get there and we have to pull those forms back up. So we're encouraging all our first responders and ambulatory high-risk workers that are going through now to make sure that they go in and look at those forms and are ready to get the shot when they pull up. But it's gone extremely well. We've been doing vaccine planning for 2 decades, both that with emergency management drills and certainly with public health. Back in 2009, we did the H1N1 and learned a lot from that. So, a lot of these plans have been in place. It's just a matter of dusting them off, recreating them, make sure that they fit, and implementing them. So it's actually going extremely well. We have great partners. We have National Guard members and soldiers that are out there doing fantastic work in our fixed sites. We have our regional public health networks going out and doing clinics for our high-risk groups. And certainly, Dr. Chan and Dr. Daly and Commissioner Shibinette and those great leaders that are leading this team. So, we're really happy with where we're at. Certainly, we wish it would go faster, but we only can move as fast as the vaccine comes in.
I was going to say, in terms of speeding things up, it's your goal to do that, but it really is just a matter of getting it from the feds, essentially, is what you're saying.
Yeah, our goal from day one has been, do not let a state process or local process slow down getting that needle in the arm of someone that needs it. It's all about how quick that it comes in from the federal government. And we expect those shipments to increase and start coming in more readily, and we're ready to ramp up as they do.
One of the unique logistical challenges here is just how cold that Pfizer vaccine needs to stay, -70 to -100 degrees. I know a lot of people in this post-holiday period are looking at their own refrigerator space, wondering where to find it. You've got to find that refrigerator space for this vaccine. So what's the status in New Hampshire on being able to store the cold storage for those Pfizer vaccines?
Yeah, it's been a challenge. I mean, it's been a challenge nationally, you know, and we talked about this with early on with PPE, is when you have a regional crisis, you can go outside the region and get your resources you need. When you have a national and a worldwide crisis, everybody's competing for the same equipment, the same supplies. So it's been a challenge. Again, New Hampshire's been pretty progressive. You know, Governor Sununu was pushing early on to make sure that we're ready. So we have the supplies we need. We've been able to either purchase, borrow, or redistribute where we need. So really the storage has not been an issue for us right now. Our immunization team is doing a great job. Part of it is that we're a relatively small state and we can make deliveries every day or every other day. So most of that cold storage is on our labs folks and our people in the immunization program to keep that cold and then ship it out, and then only in the doses needed to be used. And then obviously our hospitals are doing a great job with that as well.
As you look to the horizon, what are some of the pitfalls that you're hoping to avoid as we get through January and into February and March?
Yeah, so you know, certainly the biggest challenge is the vaccine coming in. We've already talked about that. Some of it will be weather, making sure that that weather does not slow down our distribution plans. If we have to move people a day, or we have to get vaccine delivered a day early or something, we just have to keep an eye on that for sure. And you know, really, the biggest thing that we want to stress is that there is a light at the end of the tunnel. There's no question that the tunnel is a little long right now. But by Memorial Day, we're hoping to have, you know, everybody vaccinated. We're hoping to have all our 1A people vaccinated by the end of January and start 1B in the other high-risk areas or moderate-risk areas. And the only thing that we have to say about that is to make sure that you stay vigilant. We really need our citizens, our co-workers, to stay vigilant. There is light at the end of the tunnel, but we have to continue to do the things that have worked so well. Wear a mask, social distance, wash your hands. Do not let down your guard now. There is light at the end of the tunnel, but we need to get there.
In terms of timeline, I know we're ramping up right now and you're trying to get up to speed. What are some benchmarks that you're going to want to see, say, by the end of January, by the end of February? Will the state be making public sort of where it wants to be and where it is with this vaccine process?
We will. We're going to be publishing a report on a regular basis that talks about vaccines coming in and vaccines going out and vaccines administered. We're certainly trying to get to all our high-risk health workers by the end of January, and our long-term care facility through our partnership program with the pharmacies by the end of January. And then if by the end of January we can start 1B, and that will be, you know, high-risk individuals and other moderate-risk individuals, and then hopefully 1A will flow into 1B, will flow into 2 or 1C, and then, you know, by the Memorial Day, everybody that wanted a vaccine will have an opportunity for it. You know, one of the challenges is that we have to do this twice. You know, you mentioned the cold storage, which is a challenge, a logistical challenge. Certainly not an easy one, but one that we've been able to overcome. But also, we have to give 2 doses. All these are 2 doses. You really have to get 2 doses to be fully immunized. So, you know, at the end of the day, we have to do this twice. We have to set up, you know, 2 shots, 2 clinics, schedule 2 meetings with everybody. So those are all logistical challenges that aren't insurmountable, but definitely have to be thought of.
Do you think we're going to see, with the eventual change in administrations in Washington, potentially a different approach to how the vaccine distribution plan is managed, that perhaps the Biden administration will be doing something a bit more top-down than the Trump administration? Does that change anything for you? And could it potentially be disruptive, even if they're trying to do better?
Yeah, I mean, at the end of the day, we're gonna move as quickly as that vaccine comes in. So what those decisions that are made in D.C., will they affect us? Yes, we're going to keep an eye on them. We certainly will adjust our plans based on whatever that vaccine plan is at the national level. But I don't see it changing our timeline tremendously unless there was a hiccup with the vaccine. And right now, everything seems to be going well. The vaccine is the effectiveness of the vaccine is pretty amazing, and everything has been going well. We've been able to get our supplies that we need. You know, not only do we need the vaccine, but we need all the ancillary supplies that go with it, which are the needles and all those things. And then we're also dealing with some of the vaccine doses that were going to be 5-dose vials and actually 6-dose vials. So yeah, that was a little bit of good news, but it does change your logistics a little bit.
Yeah, certainly. And you had a hard job at the beginning of the pandemic finding all the PPE. This is a perhaps even more difficult job. We wish you the best of luck, Perry. Thank you so much for your time, and Happy New Year.
Thank you very much. Thanks for having me.